Hello and welcome to the ImprovMed Show. I'm your host, Kelsey Sherwood. In today's episode, we will be interviewing Dr. Anna Galloway, an adult-based occupational therapist and faculty member of the University of Florida's Occupational Therapy Department. She is also a certified music therapist as well as an improviser. We will explore Dr. Galloway's experiences with improv, music therapy, and occupational therapy, the role improv in her professional and personal life, her unique teaching methods, her views on skill development in OT students, and the use of improv in healthcare, and her recommendations and advice. On that note, let's get started. Hi,
how are you?
I'm good. So can you tell us briefly about your career and how you got into improv?
Yeah, so I moved to Chicago over a decade ago. I no longer live there now. I'm now in Florida, but I got involved in the improv community there. It was always something that I really enjoyed. I especially enjoy watching sketch comedy shows, and I wanted to give it a try. And I had not had any experience in theater other than just being a big fan. So it was a really exciting new challenge to jump into.
And how did you use improv as you apply from as a music therapist with your clients?
Yeah, so I started my career off as a music therapist before going back to school for occupational therapy. So I was working as a music therapist when I joined the improv community in Chicago. And I honestly think that being a music therapist prepared me for improv. It helped train me a little bit. I had worked in mental and behavioral health settings and also hospice settings prior to entering the improv world. So I had already learned a lot of techniques to honor my improv partner or my patient and provide positive support to them. And I will say that the improv experience also improved those skills in the therapy world. I was able to build a really great skill of never being thrown off balance in sessions and be able to go with the flow. And I can go along with any of the most outlandish responses from a client and make a fun interaction happen.
Well, what outlandish response? Can you give an example?
Yeah, so thinking about a client who might say something inappropriate in the moment, but is very relevant. So, especially thinking about in acute care when you might be having your first post-surgical bowel movement, a lot of things can be stated in those moments from patients, and you just go along with it. Yes, that is such a big relief. So there are ways to not make those awkward moments so awkward.
Oh no! Oh boy. Oh man, I love that. This is how do you still incorporate music therapy into your sessions now as an OT?
Yeah. So I do maintain my music therapy credential, and I absolutely do use music in my OT sessions. I always bring music in if it's appropriate for the clients. If it's not appropriate, then I won't use it. Or if a client doesn't have interest in it, I won't use it. I'm currently working on creating learning opportunities for OT practitioners to build more confidence and skill in relation to using music to support their OT skilled services. So trying to help establish what OTs are able to do within our own skill set.
And how do you think the skills that you got as that you developed as a music therapist translate to being an OT?
Yeah, so music therapy was such a fun and unique career path and trajectory, and I learned a lot from that career. I used music to achieve therapeutic outcomes, so I wasn't using music to achieve music outcomes. I was never concerned about a client improving music. I was concerned about them improving their therapeutic outcomes. So this aligns really well with OT because in OT, I'm now using occupation to achieve those therapeutic outcomes. So it's a very similar process, a similar clinical approach, and similar with the intervention designing piece. But in OT, I have more options of what occupations I might use. Yes, music can still be an occupation, but now I can use music to support those occupations if that's what a client is interested in or wants in their therapy experience.
I bet that will help if, I don't know, a client played trombone, those fine motor skills, I think that would be great.
So if somebody has a music background, it's really easy to pull that in for OT because that is an occupation they're used to playing. But again, if they've never been a musician before, I can still bring in music to support other types of occupations too.
In your opinion, how does improv translate to being an OT?
Yeah, so OT is such a holistic profession. So we look at the whole person, and while that sounds really lovely and wonderful, it can also be kind of challenging. So a simple question I'm asking a client how they are feeling could lead to a long response about their family or their home or their work or their current medical situation or all of those things, and something that might be happening with their children, and all sorts of stuff might be spilling out. So improv is a great technique to bring in to validate our clients, reflectively listen to our clients, turn our clients towards a productive activity in our session, and still be able to have some type of goal-oriented outcome.
And how do you think like improv can help like OT students and like practitioners become better clinicians?
Yeah, so first and foremost, I think improv helps not only to just like get your jitters out, but also to build confidence. So the confidence to be able to handle anything that can happen in a session is a skill that you don't really tend to learn in just a typical OT classroom, right? So the ability to be flexible and adapt on your feet. Yes, we learn those things in school related to OT skills, but being able to do those with interpersonal skills is really important. So not only are we responding to something a client might say, we might also respond to something our client might be doing that might not be what we have in our head, but we want to still be supportive to that client in that moment.
Yeah, I love that. Like, okay, that wasn't the goal, but hey, you're doing great.
We're still being productive. We're still doing. That's the goal here.
Oh yeah, that is very true. Now this is a big question. Like, what do your classes look like when you incorporate improv into them?
Yeah, so I might give some specific examples if that's okay, which might be the next question. But so I teach across many different classes throughout the very first semester of the first year through the end of the fall of year two. So I teach four semesters in a row, which is a really wonderful opportunity because I get to build on the skills that I'm teaching them each semester. There's no break from me, which might be good or bad for them. I don't know. The jury's still out. But I incorporate improv in a variety of ways depending on the course. So for example, in the OT theory course, I use improv techniques to help build skills in relation to evaluation and assessment tools, how to respond to our clients while we're doing assessments. Specifically, when I teach the intentional relationship model, which is how you build therapeutic connection with your client and mend any type of empathic break that might occur. I created client cards for one partner to role play with suggestions of how to create discomfort or to throw in some unexpected responses, while the other partner doesn't have any of that information and they're learning how to listen and respond supportively on the spot and to not cause any type of empathic break. But if an empathic break does happen, which often happens in normal therapy practice, we have to recognize it, respond to it, and be able to support them and move forward. So in the psychosocial course that I teach the next semester, I have students run group facilitations with their peers. So they design and run their own groups with 7 peers. And I throw in at the last minute difficult behaviors of their peers that they have to manage in the moment too. So while we have a plan, that plan may not go as we wanted it to. And when difficult things happen or unexpected things happen, we have to manage it and still move forward. They don't know what the behavior is ahead of time, so they're learning how to redirect supportively and positively and kindly in the moment. And then the next semester in the adult rehab, physical rehab courses, they build on those skills and now do these same type of things in a more challenging simulated intervention scenario with one client with more medical complexity. So it's kind of scaffolded in the courses that I teach.
Right. Like, especially like transfers, like doing your best to communicate with them in that like scenario.
Yeah.
You never know what's going to happen.
Yeah, no, yeah, life is all about not knowing what's going to happen with the other person.
What are the current challenges that you think like occupational therapy students like face with transitioning to field work or like in practice?
This is a really great question, and I know it's a very complex type of topic. I know we know fieldwork can be very challenging for students, and I think a lot of times when students are entering fieldwork, not only is there a lack of confidence in understanding the OT skill. I mean, this is the first chance you finally get to apply that skill with real live clients and patients who need OT services, but also the ability to respond to people who need OT services verbally is also a difficult thing. So you're putting those two, your OT skills in combination with your interactive interpersonal communication. And then you throw in that there's a supervisor who has an opinion and is also trying to guide you in a process that may or may not be what it comes naturally to you. So you have to kind of respond to all these different moving parts. And again, this is not only are you responding, you're improvising on how you respond to all the moving parts. So I think a lot of it has to do with building skills, building confidence, trusting that you know enough, trusting that you're going to be okay, and that field work is not the make or break of your career in life. It is a stepping stone to graduation. So then when we enter practice, we start all over again because now we don't have anyone supervising, helping us know if we're doing it right or not. But now we have to have that internally and understanding in ourselves, whether we're being ethical and addressing the needs that our clients have.
No, I love that. That like, it's great.
It's complex. It is so complex and it's hard. Yeah.
Like, what specific skills like do you think like OT students can develop through medical improv that can like aid in their education and transition to being practitioners?
Yeah, so I think the main basic foundation of improv is being support and making your partner look good. And OT, your partner is your client, or it could be your co-treating partner. So being able to build up the people you're working with on your care team, to always have each other's back, including your patient's back. Those are skills that students can develop through medical improv as being able to find the positive, lean into the positive, and go with the positive.
It comes back to being positive, doesn't it?
Yeah. I mean, it's so easy to go towards negative because sometimes the negative is a validation we're looking for, but being able to turn towards the positive and see the thing that's going to help us grow and do more and do better, that's the part that helps us to be better clinicians and better partners in life.
And this kind of transitions to the next question. How has practicing and teaching like improv like influenced your personal and professional development?
I didn't expect my improv skills to be kind of the foundation for parenting a toddler, but it is. I am learning very much how to support my toddler child all the time and just going with his ideas. It's great. But it's something I also use in daily practice, just like going to the grocery store, when I run into somebody at Target. Like improv is just a built-in piece to our life. We can't plan for everything that's happening in life. So things do spontaneously occur, and having the improv background helps with that flexibility and spontaneity and not being ruffled by the unexpected.
Like you're no longer surprised. You just go with the flow.
Yeah. What is life if not a giant surprise?
Very true. Very true. Are there any memorable moments or like stories that stand out from your experience with implementing those improv activities into your courses or like into your treatment sessions?
Yeah, so I really enjoy watching students in the classroom try something out, noticing that it failed miserably, and then looking at me going, "Can I do that again?" And saying, "Yeah, you absolutely can." And then they finally get it. I really hope that when students are in my classroom, they are very willing to try and fail. Failure is such an important part to learning how to try and succeed. So I really encourage that and encourage them to try to say a phrase. And if it sounds like it doesn't come out naturally, then maybe rephrase it and try again. And also to support their peers in figuring out the best way to respond to. And in treatment, improvising with any client, with any situation just kind of happens naturally. And again, going back to the normal post-op needing to go to the bathroom. Those types of things are just kind of embedded in what we do in OT. We're always going to have something surprising happening.
Right. And I love what you said earlier. It's just it's okay if they fail. It's a safe learning environment. That's the basis of kind of what a medical improv is. It's experiential learning. You're experiencing it, you're learning it, and it's okay that you fail sometime. So
yeah, and I'll say I have failed miserably with clients before, and I'll say something or I'll do something or I'll go with the flow and they'll look at me like I have 8 heads and I'll go, you know what, that didn't work. Let's pretend that didn't happen. Let's try something else. And when you do that and you improvise, when you do flub, when you improvise and say, that was my mistake, clients laugh and they think it's so funny that you as a medical professional might have made a mistake. And then they think it's really fun. And then you build more rapport and keep going. So it's no big deal if there's a failure in a situation, as long as you address it.
As well as you address it, you learn from it. Okay, so next time when this happens, let's do this instead. You're trying out different strategies, different ways you can do a task or something like that.
Yeah, and I will say what does work for one client or patient does not always work for all of them.
No.
Read the room, read the client, make sure you know what your approach is going to be for the specific person.
Yeah, that's another thing about improv is just looking at body language, their attitude, their emotions. You got split second to see all that as well.
It was really fun to be in the improv community where you would go places and it would be a whole new group of people and you're having to learn each other on the spot and learn what somebody might be thinking or their thought process and being able to respond to that. It was really fun.
And that's the same with practice. You're with these old different people, in the same way, you're different personalities, same thing in improv.
Yeah, exactly. Yeah, it's a perfect setup for building success in the clinical world.
Are there any specific resources or workshops or training programs that you recommend for learning about medical improv or improv in general?
More improv in general, I really suggest getting involved in the local improv community. Any local improv community is going to welcome you and improvise and support you like you're the improv moment. So if you're new to it, it's going to be a very welcoming place to go. And it helps build the skills that you need for medical settings since you also work with a variety of individuals. So like what you were just saying, not only are we learning how to work with different types of clients, we're also learning how to work with different people on the care team. And so just being involved in improv in general can build that skill.
What future directions do you see the use of improv in healthcare or an OT or just in education wise?
Yeah, so I'm kind of always trying to balance the fun side of improv where you get to be creative and imaginative and then trying to bridge it into the seriousness of what can happen in healthcare education. It's a hard balance to find. So I'm always kind of introducing it. So like I was saying earlier, when I teach those 4 semesters back to back, I have the luxury of being able to build those skills from a fun place to a more serious place in healthcare. So where I really do see medical improv really taking off, especially in OT or in other supportive therapies that we have or in other rehab therapies, I think that simulations and client simulation scenarios is going to be where we're going to see it grow most. It's fun in the classroom to build those skills, and it's necessary to do it in the classroom space, but in labs as well. That's where you get to try it out. That's where you get to try and fail in a safe place before you go out onto any type of fieldwork rotation.
Like it's like a preparation for the simulation, and then it's just a lot of prep work.
Yep. And it's a lot of scaffolding and breaking it down. Again, that bridging the fun side, the creative side, the like exciting part of OT, and then putting it in a more high stakes situation with actual client scenarios. It's a hard bridge and it's a hard process to get to. And it has to be done intentionally so that you are building on skills and not creating more anxiety or hurting confidence in more ways.
What advice would you give to other like OTs or other health professionals interested in like medical improv?
Yeah, I would say it's important to get involved in improv in general, just to understand what improv is. And then it's also important to talk to other people who might be using medical improv in their classroom settings. Don't be afraid to try it. Go with the flow, give it a try. I think it's important to just jump in and see if it works for you and to see how it could be implemented into your own practice.
Can you lead us through a simple improv exercise that the listeners can try out to understand its benefits?
Yeah, so it's kind of hard to lead one since I won't be able to hear anyone's responses. But if you're listening, do try to come up with your own response as I describe kind of the format for the game. So I don't know who created this exercise, but it's one I've been using for several years, and I really fall back on this a lot with improv teaching. Okay, so here it goes. We're going to do it with a 2-station approach. You can always add more stations if you want to build more off of this, but it's a good intro with 2 stations. So at station 1, I might have a group of 6 people, and I would give a word to this station, and they'll be given the space to riff off of that word that I provide. So, for instance, I might say the word beach house, and now that station goes in a circle and plays word association. So you might get beach house, beach ball, basketball, Michael Jordan, Chicago, deep dish pizza, and so on. So then station 2 has a group of another 6 people who are listening to station 1 as it's going. So they're having to really intentionally listen and then respond in a way that supports all of those responses from station 1 and include it into a funny premise using all those words. So you might get a funny setup like Michael Jordan is in his beach house eating a Chicago-style deep dish pizza off of a beach ball while dribbling a basketball. So we've now used all of the words and we have a funny premise. And once that group is at a consensus that they agree on the premise, so you might get many different iterations from that group on how they might set it up or change the words around. And then all 12 participants work together to create a funny title that captures the essence of whatever the premise is.
Oh, no, I love that. That's a great story.
It's a really fun one. I really like doing it. I have no idea who created it. But again, you can build more stations in and build out more and actually do the improv sketch for that, where you actually have like maybe Michael Jordan's hosting a big party. And now it's like all these people are there and you're improvising together for this premise.
How can listeners incorporate like some basic improv skills to their daily lives to help improve their communication and adaptability?
Yeah, that's a really great question. I think in daily life, it's always fun to accept a new challenge and maybe to challenge yourself during interactions that feel uncomfortable or unexpected. But that only happens if you notice that there's discomfort or that something unexpected occurred. So you have to be at a place to willingly accept that and to recognize it. Another thing to try is just listening to conversations, like go to Panera, I don't know, listen to other people talking and come up with how you might respond in a way that is supportive or builds off of their ideas or creates a funny, hypothetical story from it. So learning how to build off of ideas and flex that creativity is really going to help to flex that new muscle for improvisation.
I think that sounds like a great activity for someone like who's like really shy too, like someone who has that social anxiety a bit. Just like you're not really talking to them, but you can pretend you're talking to them.
Yeah, and then just make sure you don't laugh awkwardly at whatever you came up with in your head.
You're laughing by yourself at the cafe table.
So yeah, it's a fine balance of how much you try.
Yeah. Yeah. Like, it's just like all about like getting out of your comfort zone, because that's what improv kind of is like.
Mm-hmm. And and that just goes along with OT in general. As OT students and OT early, like new entry level practitioners, it's all uncomfortable. Like becoming an OT and going through school is uncomfortable. You shouldn't come in with all the skills to be an OT, or else what's the point of having a program to teach you OT? Like you have to learn it. It's uncomfortable. You're going to push yourself. You're going to challenge yourself. Becoming an entry level clinician, you're going to push yourself. It's going to be uncomfortable. So being okay with the discomfort and learning how to respond in a way that's supportive and positive for everyone is really important.
It's just like your discomfort about like learning all this material, then your discomfort about graduating, then your discomfort about like, oh, I'm the professional now.
Yeah. And you only learn and grow when you're uncomfortable. So it's important to be uncomfortable. Let that discomfort happen. So once you learn to embrace the discomfort, you learn to enjoy the life that you're in.
I'm going to steal that quote. That's a really good quote.
It might be like somebody important said that and I just remembered it and said it. So don't give me the credit.
Any final thoughts or additional advice like you like to share to the listeners?
I think just kind of summarizing the same thing, that it's okay to be uncomfortable. It's okay to fail. It's okay to try and fail. It's okay to try again and fail again. That's what leads to being able to try and succeed, and to becoming more comfortable, and to building more confidence, and to being more flexible and adaptable. All
right. Well, thank you so much for coming on the show. I really appreciate it. And I loved all your answers. You're fantastic.
Thank you.
Thank you so much for listening to this episode of the ImprovMed Show with Dr. Galloway and myself. A very big thank you to Dr. Galloway for joining us today. Next week's episode, we will be interviewing Beth Boyton, a nurse, author, and medical improv educator. Please follow the show's Instagram and Facebook account called ImprovMed. Another great big shout out to Doug Roizen at Palmer Music to recording and editing this podcast. See you next time.